the Greeks and Romans saw it as lunatics, and many thought it meant that it was being possessed by evil spirits. But epilepsy is actually a brain disorder, and it's produced by seizures called convulsions, and Brace causes the connectivities with another part of the brain to lose connection. And I'll explain some symptoms that you can see. So if you were ever to see someone having an epileptic moment, you won't think they're being possessed. I've been someone who has been diagnosed with epilepsy, and it's something that can happen unexpectedly. Some of the brain disorder produces seizures, and it loses connectivity in the part of the brain, which causes to twitch or even lose consciousness. So I believe it's something that can help others know about it, and you can help someone prevent future injuries, like making them hit their head or something. So epilepsy, I will talk about what is epilepsy, the history of epilepsy, what are the symptoms, and how to help someone who is having one, and the effects that epilepsy causes. So what is epilepsy? Epilepsy is an uncontrolled electrical signal that is discharged from the cerebral cortex, and the cerebral cortex is what controls your movement, your sensation, and your behavioral reactions. And what happens is it bursts abnormal electrical signals to the brain, which causes it to kind of like freeze. And epilepsy was known for about 3,000 years. There's a tablet of Babylonia that existed in Sumerian language speaking of epilepsy and the symptoms it had, and it described it as a possession of devils. Until 19th or 21st century, they found out it was just a brain disorder that was happening in the brain. There are two types of epilepsy. One of them is partial seizures, which is one part of the brain is caused by it. It's likely to develop from a head injury. The partial seizures is divided into two types, which is simple partial seizures, which is involuntary movement, deja vu, or perception of odor. When you smell something that's similar, or you feel like you've tasted something before, that's what causes one of the brain to lose connectivity. And then there's also complex partial seizures, which they begin to appear spaced out, or they begin to do repetitive behavior. The other part is generalized seizures, and it occurs on both sides of the brain. This is usually genetically passed on, and some of the symptoms, they become very stiff, or they'll completely lose consciousness. The symptoms for normal, like every seizure will have, they will have staring, they'll have jerky movements of the arms, thickness in the body, loss of consciousness, breathing problems, and some of them, like when their brain loses connectivity, they actually lose control over their body. So many of them will lose bowel, or they will actually urinate on themselves. Thank goodness none of that happens to me. Following, they'll fall down. When they wake up, they appear confused. Some of them don't know what happened, or they don't know where they're at, they don't know their name, birthdays. They begin to nod their head rhythmically. If you ask them questions, they'll just stare at you for a good while. They don't know what's going on. There's a lot of rapid eye blinking and staring when the epilepsy is happening. When someone is having an epilepsy, the first things you'll see, they begin to stare, just blankly stare. They'll begin to chew, they'll fumble, they'll wonder. I've never seen that one before. They begin to shake and do confused speech. For example, when I will have one, I will get deja vu, and I will just stare at you for a while, and I will get confused speech. You can ask me what's happening or something like that, and I will not be able to respond in complete sentences. I will repeat myself over and over, a simple phrase. So what to do when someone is having one, you have to lose their clothing around their neck so they won't choke on themselves. While they're having one, you do not want to do anything to them. You do not want to strap them down, and you want to remove any hazardous movements around them. When the seizure is finished, you lay them to their left side, so you can put so they won't choke on their tongue, because many, when they have a seizure, their jaw locks, and it causes them to bite their tongue, which causes them to bleed, or it also causes them to try to swallow their own tongue, which can lead to choking. That's why you want to stiffen the things around their neck. And then you want to to put something comforting on their head because while they're having the epilepsy, many of them will start jamming their head on the floor or something, and you don't want any of this. So what causes this? Many are born with it. Some of them are birth trauma or congenital problems, which an example could be cerebral palsy, which is lack of oxygen to the brain. Another could be fever or infection when they're born, or metabolic or chemical imbalances in the body. For adults, alcohol or drugs actually causes this. A stroke can lead to epilepsy, and also Alzheimer's disease for older people actually lead to epilepsy. Some other ones can be brain tumor, neurological problems, a head trauma. When you hit your head, that's when it's kind of freak out when you have a head injury, because it can also lead to epilepsy. Also, many are inherited, and there's many other unknown reasons why it is happening. Some effects that epilepsy causes can be memory and learning. It depends on the affected area of the brain. Social and behavioral consequences. They have trouble with language, emotional, and behavioral disorders. This is usually for children. For adults, it actually causes psychological health, which they have a higher risk of suicide due to the medication they take. It also causes depression, anxiety, and can lead to schizophrenia. And that is epilepsy. And I feel that it's something important to know what to do because you might be around it all the time and you wouldn't know what to do. You wouldn't